This question actually brings tears to my eyes. It makes me very, very sad, and it's part of why I'm here. Question: what should I do if I've tried three different younger female doctors who would rather prescribe an antidepressant than menopausal hormone therapy and can't seem to really give a good reason why they're avoiding menopausal hormone therapy? I have packed on 30 pounds in 3 years, and diet and exercise is not moving the needle for my menopausal belly, and I am beyond frustrated. Well, hello. I am beyond frustrated for you. This is not okay, and I don't know your medical history, any of you who are listening, but especially this person. So I don't know how old you are. I don't know what your menstrual cycles are doing. I don't know your past medical history in terms of what is safe or studied for your specific situation. But I will say a couple of main things. It's not okay to be dismissed by your doctor. SSRIs or antidepressants are actually really good treatment for menopausal symptoms. They're really good treatment for vasomotor symptoms like hot flashes and night sweats. Really good for some of that mood irritability and anxiety that comes with menopause. So your doctor's not wrong in wanting to prescribe an antidepressant, but your doctor is wrong in not considering menopausal hormone therapy or explaining to you why you may be a better candidate for an antidepressant than menopausal hormone therapy. And the 30 pounds in 3 years is the story of so many women. And this is a much bigger conversation that I would be very excited to have. But it's really important to understand what's happening. Estrogen in our body actually creates a tolerance or a sensitivity to insulin. And when we don't have estrogen, we get a bit insulin resistant. So we start to get insulin resistant. We potentially have loss of muscle. And so we start to have less metabolism in that muscle. And because of that muscle loss and that potential climbing of the insulin resistance, we do pack adipose tissue or fat around the middle. And that fat that comes around the middle is hormonally active. And so that is a vicious cycle around becoming more and more insulin resistant, which packs on more pounds. And we just don't use our fuels as well. So there's a lot of things in midlife that we need to change in terms of lifestyle, even when we're doing diet and exercise, in terms of the way that we're doing diet and exercise in order to manage the metabolism and the physiologic changes because of that declining estrogen. And I don't want to get into the big conversation right now, but I really do want to have that conversation around what are those lifestyle changes that a midlife woman must undertake in order to not pack on the pounds. Stay tuned and we'll talk about that. But if you're being dismissed by your doctor and you're being prescribed antidepressants when in fact you're a good candidate for menopausal hormone therapy, it's time to get a new doctor. So it's really important that you ask for a referral to an OBGYN or a menopause specialist.